rise in substance abuse among young Americans. These are the latest results of a multi-year survey. They show that 81% of adults aged 19 to 30 used alcohol in the past 12 months. 42% used marijuana, 21% said they vaped nicotine, and 18% vaped marijuana, smoked cigarettes, or used other drugs. Dr. Nora Volkoff is the director of the National Institute on Drug Abuse. She joins me now. So, Dr. Volkoff, how concerning are these statistics?
Well, they are concerning because we are seeing a significant rise in consumption of marijuana across all age groups. That is most severe among 19 to 30 years of age. And the main concern is that it is actually, we're seeing rises in regular use of marijuana, which is the consumption pattern that is more likely to result in negative outcomes. And in this age group, which is 19 to 30, you still have a lot of changes happening in the brain. And one of the concerns about drug use in young people is that it can interfere with those normal neurodevelopmental processes that are necessary for your brain to fully form, because drugs basically interfere with them. And among people that are 19 to 30 years of age, for example, there is also concern that during that period, they are first of all at much higher risk of becoming addicted to marijuana or to consume it in a compulsive way that can result in negative outcomes such as psychosis. And this is relevant because more and more the marijuana that's out there in the streets is of very, very high potency, and that can trigger a psychotic episode. And among young people, these psychotic episodes can be long-lasting, and in some of them can result in chronic effects. So we are concerned about addiction. We're concerned about potential negative effects that marijuana may have to mental health, such as psychosis. Also, concerns about how it affects depression and mood and anxiety, and how it may interfere with their health. The reality is that we do not know so much about marijuana when it's consumed with such a high potency. And we are used, and your speaker before was commenting about your mother's marijuana. It is very different from what we currently have. The content is at least 3 or 4 times more powerful for the active ingredients of marijuana, which is THC, and that increases its associated harms.
Let me just ask you just to follow up on a couple of things of what you just said. First of all, you talked about how it can interfere with the neurons in a young brain, a developing brain. What does that translate into? What would the negative outcome of that be? Just so we can have a clear understanding of that. And then also, how much of this is backed by hard data?
Very important questions. And first of all, it's important to just give us very, very short summary of brain development. When you're born, your brain is very big, and when you're reaching adolescence, it almost has reached its full size. What it hasn't done is form the connections between the different areas of the brain, which is really what is crucial for the brain to work properly. It is one of the most complex networks of networks. And those connections, for example, are modulated by our own endogenous cannabinoid system. And that is where the concern goes around, that when these changes are happening, which are fastest during childhood, adolescence, and young adulthood, consumption of marijuana may interfere with this normal neurodevelopmental orchestration driven in part by endogenous cannabinoids. And so there is always the concern that it may interfere and lead to improper architecture and function of the brain. Now, you asked me about how solid the data is. There's been lots and lots of papers published showing that individuals that particularly consume marijuana during adolescence have changes in their brains as adults that, for example, implicate the limbic areas of our brain, which enable us to feel emotions and to memorize things. But the problem of those studies has always been that you cannot distinguish between changes that may have existed prior to consumption of marijuana that led them to smoke marijuana, make them vulnerable for that, as opposed to marijuana directly producing those changes in the brain. In order to address this, we're currently doing a very, very ambitious study that is following longitudinally children as they transition from age 9 to 10, and they'll go into adulthood to try to answer that question, whether, because we will have brain images of them before they consume marijuana, and then we can monitor whether there are differences between those that consume versus not when you are controlling for how their brain looks like before.
Interesting.
So this is an important question that still needs to be answered.
All right, Dr. Nora Volkoff, thank you for your time. And you were in the CNN newsroom. You would think most sports mascots are there to have some